Janelle, thanks for being with us this morning.
Good morning, Chairman and members of the board. I have the COVID update for you. As of this morning, Navajo County was at 14,066 cases. 5,803 of those have been worked by our Navajo County Public Health team. The state of Arizona is at 727,895 doses. And for Navajo County Public Health staff, we received a report of 36 new cases in the last 24 hours. This information is really promising. We're hoping that we are on the downhill slide of our second spike. We're having 100 to 150 new cases reported to us a day, and we've declined from 50 to 40 to in the 30s now over the past 10 days. We're seeing the same pattern across the state of Arizona, and our 3 tribal partners are reporting a similar pattern. So that's good news for us. The thing that's still concerning is hospital bed capacity. This morning, hospitals across Arizona were 92% full. Summit is reporting to us that their ICU is full and they have 1 bed available on the regular floor. So the people that are infected are still high acuity of care, and hospitalizations are not significantly declining. So we're watching that closely. We are redistributing some of the surge staff that we hired to help with COVID and pulling them off of the contact tracing activities and training them and preparing them for vaccine distribution. So we'll just be using them in slightly different ways. Summit requested 30 surge nurses from us through our resource request line. We were able to secure those nurses for them. They are on site and have really helped them through the peak of the surge. And they are assigned to Summit through until March. So we're really hoping that we'll have enough vaccine distributed in the community by then that they won't feel the impact when those surge nurses return to their homes. We are experiencing some vaccine challenges. We are currently in Tier 1A and Tier 1B. We did add the 65 and older population to our Tier 1B, which added more people eligible for vaccines, but no more vaccine to accommodate that with. So that has been a continued challenge for us. We are still experiencing supply shortages. The demand far exceeds the vaccine that we're being allocated. We are at the mercy of the manufacturer, the federal government, and the state. And we have been receiving between 400 and 1,500 doses a week for our vaccine allotment. So we're hearing a lot of feedback from the public. They're discouraged and frustrated in trying to schedule appointments through the vaccine link. I think a lot of them think that it means that the link is broken. So we're just trying to really share the message. The link is working. It's just that there are not enough vaccines available to meet the demand. And in Navajo County, we are working with all of our partners, and the way we have opted to arrange things is we do not schedule an appointment unless there's a dose of vaccine to provide at that appointment. We feel that helps us avoid having to cancel appointments or give the public a false sense of security that they're going to be receiving that vaccine. So we continue to ask for patience, for people to please be patient with us. We share in your frustration. We know it's not a perfect system. We are working with the vendor that we use for the registration process to try to add a few new features that might help prompt messages so that people understand it's because all the appointments are full and not just that they're having trouble with the system. So we're just asking the community in general to please be patient. We recognize there's a problem, and the primary problem is there's just not enough vaccine. Once enough vaccine becomes available, we will be activating our point of dispensing or pod sites at local fire departments and opening up drive-through clinics. But for the time being, there's just not enough vaccine to be able to do that. We are starting to get some comments and questions about people receiving their second doses of vaccine. There are people now who have come due for their second dose. So what we're encouraging is that you please reach out to the facility where you received your first dose and work with them to try to schedule an appointment. to get that. And then that helps ensure that we have allocated a second dose to that facility for you. When people jump around amongst facilities, it's much more difficult for us in our allocation process to these facilities to ensure second doses of vaccine. One of the things that we're really hopeful about, tomorrow, the Johnson & Johnson vaccine product is scheduled to go before APIC, which is the American Council for Immunization Practices. And so if it's approved through that group, it will then move forward to the FDA. So we are very hopeful that within the next 7 to 10 days, we could have another vaccine product on the market. We still are waiting to see safety and efficacy data for this product, but it is a one-dose vaccine, so that could also be extremely helpful as people would not need to receive a second dose. So we're watching that very closely. And then ADHS, the state health department, has received funding from the federal government to assist with vaccine distribution. We did submit our plan to them for push through and of vaccine. I feel like it's a strong plan. We're also blessed that we have practiced our point of dispensing clinics and utilized them for over 10 years. So our community is familiar with that process, as are the fire departments that we partner with to roll that vaccine out. And I feel like that puts us ahead of the game with other counties because some of them are new to that model. So I feel like our plan is strong, and we're hopeful that we will receive adequate funding so that when enough vaccine is available, we can quickly make that available to our community. And that's my update for you today.
Thank you very much. Does anybody have any comments they'd like to share here? I just think you guys have done a fantastic job. We're blessed to have you working here with the health department. We're thankful for all of your team that has diligently worked so hard, as well as other staff members that have assisted throughout. So fantastic job. I think we're doing great.